Corona is a disease which has now come into this world. There is a pandemic, but it is not going to go away recently or in the near future. We have to learn to live with it. Therefore, what we have to do is adapt ourselves. We had this adaptation once when there was HIV, AIDS, as you know. Now, again, we will have to readapt. A lot of special precautions like social distancing, wearing mask will become a norm. We have to take all these precautions and then do surgeries. So we are doing surgeries. Now we were doing emergency during the lockdown. Now we've started doing electives as well. But the thing is that there are a lot of precautions. One, we want safety to the person who comes to us, his attenders, as well as the staff who are dedicated to help these patients who are having surgeries. So we sometimes do pre-surgery testing of COVID if required, so that we know that you don't have or you're not a carrier. Because if you are a carrier and you do surgeries, there is a high risk of you having a disease which makes you worse and your mortality could increase. So we don't want to risk anyone. So therefore what we're doing is we do testing, then we take you into the hospital. If it's an emergency, we admit you, then do the test and then go ahead. We risk our lives many a times, but there is no option. We are here to be the frontline warriors. We're here to fight the disease whichever you have. So you have a burst gallbladder, you have an appendix which is burst. You can't wait for 2 days to get the report. We have to take the risk. We have to wear certain protections, we call it PPEs, and then do the surgeries. So I don't think there is something to be scared about, and it's not something that will vanish in a month or 2 months or 3 months. You don't have to have elective surgeries if you don't want to have, but if you have a gallbladder that is troubling you, or if you have an abscess, or you have a fistula that is paining, or you have a piles that is bleeding, you want to sit on it, you're asking for trouble, because you could come then in a much more weaker condition, not able to handle it after surgery. So whether you have malignancies, lumps, bumps, very different diseases, it may be necessary to go ahead with the surgery with all the precautions and being careful that we don't give you the disease because you're coming to the hospital, and you don't give us the disease because you may be not maintaining social distancing, you may be meeting a lot of different people outside. We at Apollo are a family. We have been gearing up for the last 40 days. We've been getting PPE, masks, top of the line, all the investigations, the distancing of all the patients. We have made protocols, and we are now ready to accept all elective and emergency surgeries.